Goeiedag, good day, fellow South Africans and citizens of the world. And yes, Australia has just stated that the coronavirus is now a pandemic. And that's official. That's coming from the Prime Minister of Australia, Scott Morrison. He has called it a pandemic. And I'm reading from, I know some people call the Courier Mail a crappy, cheap little paper, and I totally agree with you. It is a crappy, cheap little newspaper, but it's the only one we've got in Brisbane, and it's run by Rupert Murdoch, which kind of spells out why it's crappy and cheap. But if anyone knows about News Limited and Rupert Murdoch, it's me. I wrote the book Murder by Media, which exposed the Courier Mail. That was back in the 1990s. But the reports they've got here are correct about the Prime Minister of Australia stating this is a pandemic. And remember, the coronavirus is now in South Africa. It's a deadly disease. It hides. It's like the burglar hiding behind your door, just waiting to come in and infect you. You just got to be so careful, guys. Just don't get into an African taxi. Don't put yourself in a position where you're in a public hospital. That's going to be the worst possible place to go, believe me. Okay, I'll just read you a couple of sentences from this first article. This is on page 8 for those of you who are in Brisbane who get the Courier Mail. The headline is Morrison Hits a Pandemic Button. And the article is by Matthew Killeran. And the first two paras read as follows. Australia has become the first nation to declare coronavirus a pandemic, activating its emergency response plans to COVID-19 sweeping the globe. Fever clinics will be readied, border security and screening increased at airports, while medical stockpiles will be boosted as the nation prepares for a likely outbreak. Now, this is quite interesting because Australia was one of the first countries that actually had cases of coronavirus. It's only got 22 cases. I know that sounds like a lot, but most of those people have been safely rehabilitated. So it is not a huge issue in Australia. The precautions they're taking are extreme. I can tell you now that the tourism industry in Australia has died. And I can tell you that if you want to fly to Los Angeles right now from Brisbane, for example, it's going to cost you something like $800 return. Normally it's double that price, but that's how desperate they are to try and get people to keep flights going. And the same thing, traveling from Brisbane all the way to the United Kingdom to Heathrow Airport, $1,000 return. Never ever been that price since about the early 2000s. This is the impact that the coronavirus is having on very reputable airlines and tourism. Imagine the impact it's having on good old South African Airways and SA Express when it comes to the overseas market. It will be devastated. Now remember, the only basic flights that South African Airways have kept open are those going to London, those going to Perth, those going to New York. Those are the flights that are going to be impacted because people are going to stop flying. So your tourism industry in South Africa is headed for a big hole in the ground. Now, also in the Courier Mail today on page 29, and yeah, I know it's a crappy paper, but look, it's worthwhile just reading what they say here, because this article is headed Coronavirus, How to Keep Your Family Safe. And I want to keep my subscribers safe, okay? That's why I'm pushing out this information so that you don't feel desperate when it comes to your neighborhood. You understand what your options are. And number one option is, remember, what's number one option? Create your home like a quarantine area, okay? And have food, water, toilet paper, medicine, anything that you need. I just went out today because I forgot to get extra soap. I've now got enough soap that'll last me 3 months. I'm actually set up to just sit inside this house for 3 months. I don't have to go outside the door. That's what I want everyone who subscribes to this channel to do. And I understand that people who can't afford to do that. But what you can do is you can just try and buy the basics. And the most important one is drinking water, okay? Just remember that. Drinking water is number one. Now, okay, so this article came out in today's Courier Mail, page 29 for those of my subscribers who are from Brisbane, Queensland. And it says symptoms of COVID-19. The disease we know as coronavirus can range in severity from being like a common cold to being on par with severe illnesses such as SARS. Or just call it SARS. Okay, guys, I'm having a brain fart at the moment. Okay, let's continue. The Department of Health in Queensland states that some people recover easily, as has been the case with the first 15 Australians who were infected, but others may get very sick very quickly. People with compromised immune systems and the elderly are at greater risk. One of the things that's happening here in Australia is the old age homes are basically going to go to lockdown. They're going to just make sure that nothing comes into the old age homes that's going to actually compromise people in there. Because if one person in there gets it, and then because it's an old age home, most of those people are going to be deceased. People with compromised immune systems and the elderly are at greater risk, although people of all ages can be affected. The Australian Medical Association states that 94% of people who have died from the virus so far were over 50. Yeah, this whole fart falls into that category. That's why he's taking steps. The onset can be marked by fever and or shortness of breath and or flu-like symptoms such as coughing, sore throat, and fatigue. Now, apparently, when you cough with the coronavirus infection, apparently it's a dry cough, which is very different to a flu-like cough where it's, you've got a lot of mucus and stuff like that. So that's apparently a very good signal to if it's a coronavirus. The onset can be marked by fever and or shortness of breath and or flu-like symptoms such as coughing, sore throat, and fatigue. It takes between 5 and 14 days before people who are infected become sick and develop a fever. Now, the more recent information is that it can be up to 27 days before people actually show the fever. But the AMA warns that this time frame could be even longer, and there you go. 27 days is the latest suggestion. The illness generally peaks between day 9 and day 13, the AMA suggests. How infectious is it? At the moment, rates of infection are doubling every 6 to 8 days. The virus is transmitted from person to person via bodily fluids, airborne droplets, and through contact with surfaces. Contact with surfaces is the most dangerous side because you can quite honestly walk into a shop, open that shop door, go in and start buying stuff and, touch your face and bang, you got the virus. That's contact with surfaces is where you've got to be so careful. So guys, if you're leaving your house, you're leaving your quarantine zone, you're going outside, and you go to the shop or you go to a restaurant or you go to the petrol station, whatever it might be, whatever you touch, please remember, you've got to have those sanitary wipes, okay? And after you finish touching shit, like the petrol pump or whatever it might be, before you get back to your car and you climb into your car, make sure you have sanitary wipes and you clean your hands with sanitary wipes. Kill any viruses that might be on your hands. Then get in your car, keep yourself quarantined. Because remember, the little bugger comes in if you touch something that it's on. It is estimated that each infected person could potentially infect another 2 to 4 people. The rate of new cases outside of China yesterday eclipsed the rate of new cases within China for the first time. Now, that's BS. I'm getting reports that China is only reporting a fraction of the actual number of people who have got the coronavirus. And these are very, very credible reports. There are potentially millions of people in China right now who have the coronavirus. It is that bad, that desperate. Imagine what it'll do in South Africa. How serious is the coronavirus? For every 100 people who get infected, 2 or 3 will die. As of February the 27th, there have been a total of 2,718 deaths in China and 43 deaths in the rest of the world. Now, you're talking about a first world type country when we talk about China. And most of the countries that have been affected so far, or who've actually reported corona cases, are first world countries because they've been able to actually identify the coronavirus. The coronavirus in places like South America, like Africa, it's a sleeping disease ready to just cover everything. Did you ever see that film called The Blob? Okay, I'm going to go so off topic now that it is just crazy, but it kind of sets out what we're talking about here. Okay, back in the 1960s, I was a young boy of about 5 years old, and my elder brother was about 8 at the time. And we were living in Iringa, which is in the southern highlands of Tanzania. And they had a movie house, and about once every 3 months they got a film. The Indian owners actually had something that went on the screen. And they had this film called The Blob. And my dad was bored, and he said, hey, let's go and have a look at this film called The Blob. So we went down to this, it was a really crappy rat hole. The rats used to run around. It was just absolutely shocking. But you could actually go and watch a film. And before we went in, Dad looked at these big posters, and there was like this jelly stuff all, it looked really yucky. And my dad said to the Indian owner, he said, is this a film for the family? He said, yes, the family will love this film. It's very, very much for the family. So anyway, we went inside there and we sat down, and the opening scene, absolutely incredible. Starts off with this asteroid coming down and crashing down on Earth, and it hits the ground and it cracks open, and it sort of lands up in like this little farm-like rural area. And this old guy hears his dogs barking at this thing, so he walks out, and he's very old and frail, and he's got his walking stick, and he walks out and he looks, and he's got his torch, and he sees this, it's like an egg, but it's broken open. So he gets his walking stick and he sticks it inside to see what's happening. And this jelly-like stuff starts moving up it. And he's looking at this, he's saying, what the heck's all this about? So he puts his stick up, and he can't see very well, but the long and the short of it is that this jelly gets on his hand and starts eating him. It's just, it's just, it's just gross. And my dad looks at the 2 little kids sitting next to me, and he says, oh no. But that's Africa for you. So we sat through 2 hours of this film where this jelly was coming under bedroom doors and enveloping people and this sort of stuff. It was just crazy shit. But the coronavirus, think of it like the blob. It's hovering around everywhere. Once it gets into South Africa, you got to be so damn careful. You've got to make sure that when you touch something that is outside, it might be a bank door, or it might be a lift button, whatever it might be, you got to have hand sanitizers, and you got to keep cleaning your hands, because if that virus gets in your mouth, you got it. It's that simple. It's that damn simple. Okay, let's get back to what this crappy little paper says, although in this report I do have to say I agree with most of what they're saying. Okay, if you're at risk or unwell, the Australian government requires anyone who is at risk of contracting coronavirus, either from having been in mainland China or having exposure to a sick person, to self-isolate for 14 days. The virus is detected via a nasopharyngeal swab, and by blood tests. The AMA recommend all health professionals who deal with suspected coronavirus patients should treat them in a non-occupied room, whether or not respiratory problems are present, and provide them with a face mask. Vaccine. There is at present no vaccine for the coronavirus. Developments are underway, including research work at the University of Queensland, but the AMA advises that a vaccine is still likely to be 12 to 18 months away. And our resident channel expert, Philippe, has said that that could all be useless because the coronavirus can quite easily mutate into a different form. So the actual vaccine they prepare won't work. You know, it's a slimy little guy. You've got to be so on your guard. How to protect yourself and your family. Okay, I'm going to give the headline and then say what they say. And it's basic stuff. It's common sense stuff. But please remember that this is very important that you get your head around this now. Basic hygiene. Cover your mouth and nose when you cough or sneeze, and do that into your elbow. Don't do it into your hand, because if you're in a family situation and for some reason you got the coronavirus and you sneeze into your hand, then you put your hand down on the table and some other member of the family goes and puts their hand on that table, they got the virus. But if you sneeze into your elbow, it's keep it away from your hands, because your hands are really the place that the passing on of the virus happens. Okay, so let's continue here. Okay, cover your mouth and nose when you cough or sneeze. Dispose of used tissues immediately. Don't leave it lying around. Medical professionals advise that if no tissue is immediately available, it is safer to cough or sneeze into your flexed elbow rather than your hands. Well, that's what I've just said. Regularly and thoroughly clean your hands with an alcohol-based hand rub or wash them with soap and warm water. Do it more than you otherwise might, particularly if you have been out in public. Wash them for at least 15 seconds, ensuring that all parts of the hand are attended to, palms, fingers, and fingernails. Now, I have to tell you at this point in time, guys, that the best way to kill the coronavirus is with bleach. I just bought a huge bottle of bleach today, because if a surface becomes conflicted or it becomes questionable, you just pour some bleach, mix it with some water, and you just wash that surface. Gone. Okay, so bleach is a necessity to prep with. Okay, let's continue. Okay. One study cited by the New York Post said that hand washing during the SARS epidemic reduced the transmission of the virus by 30 to 50%. Avoid touching your eyes, nose, and mouth. Now, we've talked about that many times. Hands touch many surfaces and can pick up viruses. Touching eyes, nose, or mouth afterwards can enable the virus to enter your body. Cleaning. Regularly clean surfaces that are frequently touched, such as door handles, light switches, kitchen and bathroom areas, and items that might be touched by multiple users, such as keyboards and telephones. Now, we're talking about almost like a communal area. If you're in home, this is why I say it is critical that if you're going to isolate yourself when the virus really goes rampant in your community, you can't let anybody in, and you've got to stay inside. You've got to have, it's got to be like a barrier, quarantine, okay? If you let someone in, might be the neighbor, and he has a coronavirus, well, you've wasted your time. By the time he walks out of there, your environment will be, guess what? It'll be contaminated, and you'll get the coronavirus. That's how darn careful you've got to be once you actually self-isolate yourself. Okay, let's continue. Okay. Hands touch many surfaces and can pick up viruses. Touching eyes, nose, or mouth afterwards can enable the virus to enter your body. Cleaning. You see, everything's about cleaning here. Regularly clean the surfaces that are regularly touched, such as door handles, light switches, kitchen and bathroom areas, and items that might be touched by multiple users, such as keyboards and telephones. The AMA state that the virus survives for 48 hours on surfaces at room temperature, about the same as for the flu. Studies have found that traces of coronavirus on surfaces could be easily removed by household disinfectants. That's why I say bleach is such a fantastic prepping item to have. Be informed. Read credible news sources or watch credible YouTube channels like the Loving Life channel. We were the first ones to break this whole thing about the coronavirus. If you go and look at the history, you'll see we were way ahead of the game. Okay, read credible news sources for information on public health, messages from government. Don't believe everything you read on social media, advises Professor Alan Cheng, President of the Australasian Society for Infectious Diseases. Bookmark sites such as health.gov.au as you can be across the latest government information about the virus. Now, I've actually sent an email today to Philippe, who's like our resident channel expert on medical matters, and he lives in the UK, and I've suggested to him in the near future, probably in the next week, we have another live stream, so he can give us an update on what he thinks people should be doing and the state of play around the world when it comes to the coronavirus. Okay, so that's still got to be confirmed, but I'm hoping that will happen soon. Using face masks. The Australian government advises that people do not need to wear face masks if they are well, but the masks are helpful in preventing people who are infected from spreading the coronavirus to others. Now, the reason they say that is because the virus is so tiny that it'll literally just go through your face mask if you're wearing a face mask. Now, where a face mask is good is if you go outside and you're tempted to touch parts of your mouth or whatever, the face mask will stop you doing that. That's where it's good. Okay? Household supplies. This is where I disagree with them. But anyway, this is a crappy paper, as someone pointed out. There is no need to panic. Buy items, but ensure you have a decent supply of some household supplies, such as laundry powder, nappies, and pantry staples, may prevent the need for supermarket visits later. Representatives from Chemist Warehouse and Woolworths said masks, hand sanitizers, and gloves were all in high demand. Now, I have to tell you that every single pharmacy I've seen in the areas around me, they've sold out of all that stuff. Luckily, I actually procured hand sanitizer and stuff like that a few weeks ago. Now they're completely sold out. You can't get it. Face masks, I haven't been able to get a face mask. Okay? They were sold out a long time ago. And of course, they come from China, don't they? Which is really useful, because China's not sending anything out at the moment. Flu vaccine. The annual flu vaccine will not protect you from the coronavirus, but the flu will also be in circulation over the cooler months, and it remains a good idea, particularly for at-risk groups. The 2020 vaccine will be available in about a month, Professor Cheng said. Make plans. If you have dependent children, adults or pets, speak to family and friends about caring arrangements in case you should feel unwell and require isolation. Now, that's really good advice. It's something we haven't suggested in the past, but look, if you've got family around the place, share with them the information on this video. Let them know how serious this is. A lot of people are still poo-pooing it, but believe me, when it comes to South Africa, it's going to go through, well, it's in South Africa. It's going to go through the townships like a plague. It's going to be absolutely devastating. And, oh yeah, just talking about that, if you have domestic labor and they go back to the township every night and come back in the morning, you're going to have to let them go. Just say, look, don't come back, and have some way of communicating with them when you're ready to have them coming back to your home, because they will be in contact potentially with the coronavirus and bring it into your house. Just think about that. Okay, work from home. Talk to your employer now about working from home arrangements you can put in place if you suspect you may be starting to feel unwell. The same advice applies for schools. Keeping distance. The World Health Organization advises keeping at least 1 meter between yourself and anyone who is coughing or sneezing. Now, I think that's no, that's not enough. You got to have about 12 feet between you and someone who's coughing. That's why traveling on public buses, trains, anywhere where you've got a confined space and people are all together, such as an airplane, South African Airways, sorry guys, you're gone. You know, anything like that where the air is circulated and there's someone who's got the coronavirus, bang. Think of the Diamond Princess cruise ship. One person had the coronavirus. After it was put in quarantine, about 20% of the 3,500 passengers and staff on that cruise ship caught the coronavirus before countries started taking their people off the ship. And, you know, that is a fact. That's how infectious this damn thing is. Okay, traveling overseas. The Department of Foreign Affairs and Trade Smart Traveller website warns of heightened risk of transmission and significant outbreaks in the Lombardia and Veneto regions of Italy, then Iran, Japan, and Daegu and Cheonggo in South Korea. The government's unprecedented ban on all travellers from China was extended yesterday for another week. And then finally, what is the government doing? State and federal health ministers will be meeting today to discuss next steps. Prime Minister Scott Morrison said there was no need to cancel mass gatherings at this stage. Now, okay, we're talking about an organised country. We're talking about Australia, where they're ahead of the game. They're like America. We had that video with Trump talking about the coronavirus yesterday on 2020 channel. Now, the problem in Africa, and you've seen it in South Africa, is that these guys, your Minister for Health is asleep at the wheel. Okay? He has no idea what's going on. He has no idea the impact that this is going to have on South Africa. Just be aware of that. So you have to protect yourself. All right? It's that darn simple. Okay, guys, I'm just going to say, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. And above all, and please share this video with all your family and friends. I know they're the people who don't believe all this crap, but just say to them, look, when it happens, don't come knocking at my door, because I will be in quarantine. If you don't look after yourself, then that's your problem. Just warn them. Best thing to do is tell them to go and listen to this video in its entirety. Because if Australia is taking this so seriously, and it's a first world country, then just think about it. Okay, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like, please share this video. And above all, guys, please, please, please stay safe. Bye for now.